Many people who are struggling with SI joint pain have tried medication, have maybe even tried traditional physical therapy, massages, chiropractic, and are not finding the results that they're looking for. They may have even been recommended for surgery, which sounds super scary, and definitely with the SI joint, it certainly is. And they were thinking about maybe doing injections, but aren't sure which injection is the right one for them. So if you find yourself struggling with SI joint pain and you've heard about different injections and you've been wondering which injection would work best for your problem, then you're in the right place, because this is what we're going to talk about today. The difference between a cortisone injection, specifically for the SI joint, or a PRP injection, also for the SI joint. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and a lot of my patients or people who are contacting me are wondering about cortisone versus PRP injections, specifically for the SI joint. So today I'm going to lay it down for you. First, let's talk about where the SI joint is located, because some people may be wondering if they're having low back pain or if their pain is truly SI joint pain. So your SI joint is located beneath your low back. So you have your entire spine, and then at the base of your spine, at the very bottom of it, you have this heart-shaped bone, and it's called the sacrum. Now, on each side, you have your hip bones. Those are called the ilium. If you put your hands on your hips, you're putting your hands on your ilium. So the joint in between those two bones, the sacrum at the base of your spine, and the ilium or the hip bone, is the SI joint, the sacroiliac joint. So in general, if you're having low back pain, you experience your pain along that belt line or even higher up. So if you were wearing a belt at your waist, it would be along that line or even higher up. This is different than if you're experiencing SI joint pain. That tends to be a lower down pain, or people will often point to their buttocks when they're talking about SI joint pain. Some people have it on one side and some people have it on both sides. But if you're pointing to kind of both sides of that sacrum and you're like, yes, my pain is right here, I pretty much guarantee you have an SI joint problem. Now, if you have more questions about if you have low back pain or SI joint pain, I'm going to have you go check out this video over here, because this is going to give you more information to help you understand if it's low back or SI joint pain. Today, specifically, we are talking about that lower buttock type pain, which is the SI joint pain in regards to a cortisone injection or a PRP injection. All right, the cortisone injection's been around longer, so we're going to start with that. There are a lot of pros to the cortisone injection. Cortisone is an anti-inflammatory. So the idea is they're going to inject this cortisone, this anti-inflammatory, directly into the joint. When they do that, that decreases inflammation in the joint, which then allows the ligaments which are surrounding the joint to be able to heal. See, the ligaments can get stretched out because the joint has so much inflammation in it. It's like a balloon, so it will actually kind of stretch to accommodate for that extra fluid that's inside of the joint. And so having that cortisone injection decreases the inflammation, which will then decrease the stress on the ligaments. Now, the challenge is how do those ligaments heal? And the truth of the matter is they heal very slowly. Ligaments just heal slowly in general. They don't have that great of blood flow, and they are really, really thick around that SI joint. So you may get a cortisone injection and then have decreased pain. However, you feel like you're not quite as stable as you were. That would require some work on those ligaments in the long term to make sure that everything heals up correctly. But the cortisone injection is going to decrease the inflammation, or it should. That's what it's designed to do. And that will allow you to move more normally. As you're able to move more normally, those ligaments, those muscles, all the tissues around there are going to be able to heal over time. A word of caution, although the cortisone injection will probably decrease your pain pretty quickly, the long-term effects will wear off. It usually lasts between 3 to 6 weeks to reach its maximum efficiency, but you want to make sure that you are working with a specialist physical therapist who can help you understand the movement patterns that you created in the first place that cause this. Because the cortisone injection only works for that short period of time, about 3 to 6 weeks, and you don't want to have to keep going back to get cortisone injections. Injecting cortisone directly into a joint does have some potential long-term deficits, and this is why they won't do more than 3 injections, usually over an 18 to 24-month period of time, because it's not great for your body. It can cause issues with the tendons and the ligaments. Obviously, just the act of doing the injection can potentially have some issues like infection or damaging other tissues as it's going in. That is very, very rare. That would be definitely not something I'd be super concerned about, but it is definitely something that your doctor will talk to you about because it does happen sometimes. They're going to do everything they can to keep any infection from setting in. However, even the best precautions, sometimes these things do happen, and they need to talk to you about that beforehand just in case. Now, one thing that I do feel is very, very important to point out is if you have any difficulty regulating your blood sugar, I definitely want you to know that a cortisone injection can significantly affect your blood sugar. So if you are on insulin or if you've been diagnosed as pre-diabetic or diabetic, I definitely want you to talk to your doctor beforehand about what you should do regarding your medication, because I have seen people really tank after a cortisone injection because they didn't have this conversation beforehand of how to handle this. So if that's you, make sure you have that conversation with your doctor beforehand because you want to make sure that your blood sugar doesn't get too adversely affected. Now, chances are good that you have heard of a cortisone injection. You may even know someone who's gotten a cortisone injection before, but you may not have heard of a PRP injection. So this is a newer technique, and by newer, I mean it's been around over 10 years. However, it also does mean that there's less research about it. Because there's less research, because it's a newer technique, it's not covered by insurance at this point because they determined that it is experimental, which is a challenge because then less people get PRP injections and then it's harder to do the research on PRP injections. Okay, but what is a PRP injection? So what's going to happen in this case is they're going to actually draw out some of your own blood. They're going to put it in a centrifuge, which is this machine that spins around really, really fast, and they're going to pull out the plasma. So PRP is plasma-rich protein. Well, they get the plasma directly from you. They're then going to load that plasma up in a syringe, and they're going to look under what's called fluoroscopy. So they're going to be looking directly at your joint, and they're going to put the plasma directly into the ligaments and the SI joint. Now, this is nice because you actually get the plasma, which is the healing properties of your blood, directly into that area that's being affected. The idea is that it is providing your body directly at that location with the different tools that it needs to be able to heal itself. So what's the big con of a PRP injection? I would say one of the biggest cons is that you're not going to notice the effects as immediately as you will with a cortisone injection. So the PRP injection provides the building blocks, but it's going to take a while for your body to process that and for you to actually be able to see the changes. Whereas with a cortisone injection, that tends to be more of a faster acting medication. And of course, with the PRP injection, just like with the cortisone injection, there is a risk of infection from having an injection put into your body at all. Again, it's very small and it's very well mitigated, but I always like to mention that because the doctor is going to mention it because there is a small risk with the infection. All right, so which one does the research say is clearly better? Well, I alluded to this towards the beginning of the video, but very clearly cortisone is the winner when it comes to the research. However, I believe that that's because cortisone has been around longer and there has been more research done specifically to cortisone. There's way less research when it comes to the PRP injections. Now, here's another very critical point, and I really want you to listen to this because I have had multiple patients get PRP injections, or they become my patients after they got PRP injections, and there's been variability in how they've done with it. I would say probably about 50% are glad they got it, and 50% question if it was actually helpful at all. So I talked to a local doctor who is basically only doing PRP injections at this point. And I asked him very point blank, I said, listen, I am not seeing great results with it in my patient population. Can you tell me what your results are? And he said, oh, I have, fantastic results. Everybody gets the results that they're looking for. And I'm like, okay, how is that when the other doctors are not getting the same results? And he said something that was very interesting and that I promised to pass along to everybody I met in the future. And that is this. He said, I get the results I'm looking for because I have people agree to 5 to 6 PRP injections before they ever get the first one. 5 to 6. Now, up to this point, all of my patients had had one PRP injection and then decided if it worked or not. What he was saying was for people with chronic, long-standing issues, they were going to need 5 to 6 PRP injections. Now, this is huge because these injections are not cheap. But he actually has people sign paperwork that says that they will agree to 6 injections. Now, if they, along the way, get the results that they're looking for and they determine that they don't need all 6, he's not going to give them all 6. He's just going to give them what they need. But he wants them at the beginning to commit to 6 in order to get the results that they're looking for. And when you're looking at a PRP injection, there's the rehab time, there's the resting time, and obviously there's a cost with each injection. So you're looking on being kind of a long road potentially to do the PRP injection, which is certainly something that you should also consider. In my professional opinion, as a PhD in orthopedic manual physical therapy, which injection do I prefer? Well, friends, I'm going to be honest with you. The answer is it depends. And it depends on what is primarily affecting you. So if you are having pain and dysfunction that is primarily driven by inflammation, I would highly recommend the cortisone injection because the sooner we get that inflammation in the joint down, the sooner the ligaments and muscles are going to start behaving correctly and you're going to get back to your functional activity, which are what actually heals your body. However, if your SI joint pain is due to ligament issues, specifically ligament laxity, or due to osteoarthritis in the joint, I would recommend taking the longer road, which is the PRP injection. The reason why is the PRP injection is actually going to help heal the joint. It's actually going to help heal the ligaments, and in the long term, you're going to get better results from that. And that's the challenge, is that everybody's different, and it's really important to understand, even if you have the same issue as somebody else, SI joint dysfunction, there's different reasons, there's different compensations, there's different lifestyle habits that are either driving this or allowing this to heal faster. So it's not an easy cut and dried answer. It's not black and white that you should do this or you should do that. But I hope that this video has given you the tools in order to understand the thought process that I would put in or I would go into with my patients to help them decide which one is the best for them. However, if there's any questions that you have, please drop them below. Be happy to make another video to answer your questions specifically. Now, if you are struggling with SI joint dysfunction, chances are good that you probably have some pelvic floor issues as well. So I'm going to have you go check out this video over here of the one exercise that I recommend every woman do with pelvic floor dysfunction, or even just because they're a woman. And no, it is not a Kegel exercise.